Hi, I'm Thomas Duffy. I'm an orthopedic surgeon here at Mercy Fitzgerald Hospital. I specialize in sports medicine and joint replacement surgery. With the hip replacements, utilizing a mobile bearing hip joint for the younger patients, it feels like it gives them a more natural feel, and they're able to, the hip should last longer, which is even better for the patients. The other option that I'm doing now is a joint preservation surgery, something called Subchondral Plasti, where we're trying to prolong the patient's normal knee instead of having to go right to a knee replacement. It's much less invasive. There's very small incisions. The patients are able to walk on their knee right away. They can get back into their routine much quicker. We're not replacing anything. We're just trying to strengthen up the bone underneath the articular cartilage to make that better and decrease the pain. My philosophy is always to treat the patient. I don't have to just treat an x-ray. A patient comes in that has arthritis on an x-ray. I don't say automatically you need a knee replacement when they haven't tried anything else yet first. So I try to have a relationship with the patient that we can discuss the options and do what's best for them first. And when they're ready to have a larger, bigger surgery, then they're more comfortable with me. And we can do it that way. So I like to develop a relationship with the patients that they trust me and they understand how I'm going to treat them. With the electronic age, the patients have access to so much information. And many of them do come in saying, I looked at this on the internet, I've done my research, and I want you to do this. Or what about this? And they want to know. Because they've looked it up, and it's more than just, well, my neighbor Joe said this. This is what it says on the internet. It's got to be, I want the facts. And you try to sit down, and some of the stuff, they're asking about medications that there's no real research on, but then there's other things with the procedures that they're right on it. And the patients have an idea what they want and what they don't want. And I encourage that the patients, if they want to have more information, it's out there, and to try to get them to look at it. We have 3 children from my family. I have a twin brother, an older sister. All 3 of us are physicians. My wife is a physician. We met in medical school. It is a family of physicians. My mother's a nurse. My father works in computers, so he has nothing to do with medical school. So conversation at the dinner table is a little bit interesting sometimes. But I like to spend a lot of time with my family. I've been affiliated with Mercy Fitzgerald Hospital for the past 4 years. What I like most about the hospital is we do have a team approach, but it also is a family approach. People and the staff, from the physicians down to the nurses to the care coordinators, all treat patients the way they would want their own family to be treated.